Hey everyone, and welcome to Mental Health Unit 2. Today, we're covering three major topics: bipolar disorder, personality disorders, and neurocognitive disorders like schizophrenia and Alzheimer's disease. Let's break it down in a way that's easy to understand. Bipolar disorder. Bipolar disorder is a mental health condition with dramatic shifts in mood, energy, and ability to function. Think of it as alternating between emotional highs called mania or hypermania and lows, known as depression. Manic phase. During a manic episode, people may sleep very little but feel full of energy, speak rapidly, jump from one idea to the next, take big risks like spending sprees or unsafe sex, show extreme confidence or even delusions. Depressed phase. On the flip side, depression can cause low energy and mood, sleep changes, weight gain or loss, feelings of worthlessness, and sometimes suicidal thoughts. Clues it may be bipolar disorder include early onset, family history, and mood swings that don't seem to follow a pattern. The average age of diagnosis, around 25. What causes it? There's no single cause, but likely a mix of brain chemical imbalances, genetics, environment or trauma. Substance abuse, treatment often combines mood stabilizers like lithium, therapy, possibly ECT or substance use counseling. Pro tip: lithium requires regular lab work and can take 7 to 10 days to reach effective levels. Watch out for signs of toxicity, especially if the patient becomes dehydrated or has a fever. Personality disorders. These are long-term patterns of behavior that affect relationships and daily life. A key sign is interpersonal dysfunction, meaning it's hard for the person to form healthy relationships. Personality traits can become a disorder when they're rigid, impulsive, emotionally reactive, antagonistic or withdrawn. These disorders are grouped into clusters A, B, and C, but we'll go into those in more detail another time. Treatment typically includes therapy like CBT, group support, meds for anxiety or depression, often SSRIs, schizophrenia, and other psychotic disorders. Schizophrenia is a chronic brain disorder that affects how people think, feel, and behave. Key symptoms include delusions, fixed, false beliefs, hallucinations, often hearing voices, disorganized thinking and behavior, limited social engagement. Causes. There's no single cause, but dopamine imbalance, family history, and social dysfunction all play a role. Treatment: antipsychotic medications, therapy and support groups, life skills and social training. There are two types of antipsychotics. Typical like Haldol, treat positive symptoms, but have more side effects. Atypical like Seroquel or Zyprexa, treat both positive and negative symptoms, with fewer side effects. Watch for side effects: muscle rigidity or tremors, extrapyramidal symptoms, sedation, sun sensitivity, weight gain, tardive dyskinesia, lip smacking, grimacing, and tongue movements. Use the AI MIS form to monitor for these movements. Nursing tips: take meds with food if needed. Encourage compliance. Avoid sudden med changes. Watch for interactions with antacids and alcohol. Neurocognitive disorders, NCDIS. Let's wrap up with cognitive disorders like delirium, dementia, and Alzheimer's. Delirium comes on fast, sudden confusion, memory issues, and hallucinations. It can be caused by dehydration, infection, especially UTIs, medication side effects, anesthesia, or stress. It's temporary and goes away when the cause is fixed. Dementia is slow and progressive, especially in Alzheimer's. It affects memory, language, reasoning, planning, social awareness. Alzheimer's is the most common form. There's no cure, but meds like Aricept and Namenda can help symptoms. Nursing interventions: stay calm and use simple language. Don't argue, redirect gently, use touch appropriately. Keep the environment safe and structured. Support daily living and social interaction. Wrap up. Mental health nursing is all about understanding, empathy, and clinical awareness. Whether it's a mood disorder like bipolar, a personality issue, or cognitive decline, your role is to guide, support, and advocate. Thanks for learning with me today, and don't forget, your presence matters.